work with the property owners first in some cases on a voluntary basis, but in the end it's always an enforceable thing to correct lead hazards, in the housing before a child becomes, before any children that live there, their blood levels go up, or if no children are there, that the housing is repaired before that happens. It's a big task. Certain zip codes, they may have 10,000 housing units in them, and we've been doing this for 5 years. But so far, the counties have been very successful at entering houses and getting houses inspected, either visually or with an XRF, linking the property owners to sources of funding to correct that housing. We're not able to spend our money on fixing the houses, but a lot of these communities have HUD grants. They've used these dollars that we give them to identify, target housing with lead hazards, to get HUD grants, to say, look, here's where our lead poison kids are. We have money to identify the houses. We can give you units that we are already inspected to put into a HUD program. So it's brought a lot of HUD dollars into these communities. It's been very successful. It gets a lot of attention from our executive staff, and we're about to undertake a thorough evaluation of the program to see, over time, as we've added counties into this process, are we seeing changes in blood lead levels in these communities? It's a difficult thing to measure, a community, the community's blood lead level, and we're really just at the point of determining, what's the right way to do this evaluation. But we're committed to looking at the program and seeing how we can, seeing if we can learn something from it, and if we have to, adapt, we'll adapt. If it's working well in certain places, certain types of activities that they're doing are working well, we'll continue those. So it's been, it's been a great project for us because it gets us out of the problems that a lot of health departments have in saying, sorry, your kid's blood lead level isn't high enough. We just can't come to your house until something worse happens. We can, in these certain communities, simply tell people, yeah, we'll come over, we'll take a look at your house, and we'll see if we can, work with your landlord or you yourself, if you're the property owner, to get lead hazards corrected before blood lead levels are something we don't want to talk about.
That's a terrific segue, Tom. I was just thinking, because what Dalila is going to talk about is what they're doing for blood lead levels before 10, under 10, to kind of keep those kids case managed prior to ending up in the health department's hands. So thank you very much. That was terrific. When will you know about the results of the Medicaid waiver proposal that you've submitted?
Well, we're probably a couple of months off on that. I'm not sure exactly. There's a lot of back and forth that happens with this, and I don't think there's a specific deadline date where we have to know by then, or it's not going to happen. I think the back and forth continues until they decide this is done. I think we're looking at probably at least 3 more months before we hear one way or the other, and I'm probably being optimistic by saying that, but I like to be that way. Anyway, thank you for your time. If you have any questions, I'll stay on the call till the end, and thanks again.
That's great. For both Tom and John, I'm getting a lot of feedback that people want more information, some of the details that you've talked about. Is it all right for me to share your contact information, or is there information that's already maybe typed up about this approach that we can share?
Well, I think in my case, I gave the website right off the bat. I'll run it by you again. If you take a look at that, there's much more information there than I just gave. If they have more questions beyond that, certainly you can give out my contact information, and I'll either give them an answer or I'll get them to the right person. But it's www.health.ny.gov, and you'll see that I think it's a button you can go for that's the Medicaid Redesign Team, MRT. It may just say Medicaid.
So say it one more time, Tom. I'm going to put it in the chat here.
www.health.ny.gov.
Okay. And Medicaid redesign.
Feel free to share my contact information, Rebecca.
Okie dokie. Thank you. And I know, John, at least for you, you typically present at the National Lead Training Center in Chicago. Are you on the docket this year?
I am for March.
Okay. So that's another time where people probably can hear more about the work that you're doing there.
Yes.
All right. Now, Delilah, the lead program manager with 16th Street Community Health Center in Milwaukee. Thanks for joining us. I'm going to bring up your PowerPoint.
Thank you for inviting me. So 16th Street Clinic is an accredited Joint Commission community health center, and it's been in existence for about 40 years now, and provides a variety of services, medical care, behavioral health, social services, and it has quite a few of community health workers as well, the lead outreach program being one of them. When the program was implemented in 1995, the 16th Street Community Health Center, and I will refer to it as SSCHC just to make it short. When it started its program back in 1995, our service area had a lead prevalence rate of 36%. Over the years, we have brought it down, and as of last year, 2011, we brought down the lead prevalence rate to 1.8%, and that is due to testing over 6,000 children were tested through our facilities. Nationwide, in comparison to the nation, we have the nationwide lead prevalence rate is less than 1%. For Wisconsin, it's at 1.2%. And on a local level, for the city of Milwaukee, is at a 3.4%. So it's a lot higher than the national level, just for the city alone. And we do have certain zip code areas. We have one, which would be our 53206 zip code area. It has an actual lead prevalence rate of 17.5%. How we've done this is our medical providers, our team here has implemented lead screening for the well-child checkups, and the children are screened at 6, 12, 18, and 24 months of age during their regular well-child checkup screenings, and then they're tested every year from there on out if they have normal lead levels. So now part of the screening process is we receive referrals from our medical providers for any child with a lead level of 5 and above. So that comes through our medical clinics and our WIC site, and also through our door-to-door activities canvassing throughout the community. So what we do is we provide home-based education where we go to the families and we talk to them about lead, explain to them how it affects the child and their developmental, and we also give them some information as far as when we perform visual inspections of the home, we give them short-term remediation services. We also provide them in-home interim control services where we go out to the homes and perform interim controls and vacuuming, windows, and cleaning, and also making referrals to our Milwaukee Health Department's lead primary prevention program, which is a window abatement program here in Milwaukee that's funded through HUD. So our families are visited on a regular basis depending on the child's lead level. We would coordinate follow-up services for the child to be brought back and tested. What we do for the children with lead levels between 5 and 9 is we provide our early intervention services. In those services, we go out to the homes, talk to the families about lead, and then we also we will perform in-home testing if needed, and we'll talk to the families about nutrition and how nutrition helps them lower down lead levels, following up with the families in ensuring that the children are being brought back and calling and coordinating for them to be brought in to be tested. 16th Street Clinic, one of our reasons for our success is we have an on-site laboratory services. So our families, when they have to bring the children in to be tested, there is a lab that provides the services on-site, which helps immensely when you're working with low-income families and they have challenges with transportation and getting to different locations to receive the services that are needed. One of the biggest successes in our program is that we are able to go out to the home and provide the services to the family. Now, all our staff here is bilingual, so we are able to provide the services in the preferred language of the family. So we have that, and we also we work very closely with our Milwaukee Health Department as well, with the families in coordinating services and working with some of the landlords and getting them to come into the homes and make the homes lead-free and safe for the families to be in. Most of our funding comes through the state. We have a staff of 5 bilingual staff members. We have the program manager, the program assistant who coordinates follow-up services with our medical providers. When we receive referrals, there is coordination going back and forth as far as when the children should be brought back depending on the lead level that they are at and when they would need rebleeds and follow-up testing for those families. And we also have our community capacity builder who receives referrals from our outreach workers. When the outreach workers go to the home and see the conditions of the homes and the family is not the homeowner, they will receive a referral to our community capacity builder who will contact the homeowner and work with them in finding resources in order to be able to abate the homes and make them lead safe for the families. We receive about 150 referrals a year through our medical clinics, through our medical and WIC clinic, and we usually admit about between 200 and 250 families through our door-to-door activities. Now, with our door-to-door activities, we use a GIS system, a geographical information systems, with the most current census information, and we target neighborhoods that have children that are highly concentrated with children under the age of 5 and that live in housing that was built before the 1950s. So what this program is, it gives us targeted homes and neighborhoods where we can go, and we actually go out into the neighborhoods and knock door to door, asking families if the children have been tested recently, if they know what their lead levels are, and to offer our services of providing them the education and more information about lead and ways of preventing their children to become lead poisoned. We've seen great success in that. We have, over the years since the inception of the program, we've provided services to over 5,600 families. We currently have about 2,000 families that are active that's 1,000 families that are active with about 1,500 children that are enrolled in our program currently at this time. So families are visited on a regular basis, and then they are discharged once when it's appropriate. Once the family is either comfortable with the information that they have, or the children have come down with lead levels below 5 for 2 tests. And the major components, the objectives of the home visit is to collect the demographic information, to conduct the environmental health assessment, provide parents with the lead education and setting household goals, conducting lead tests and making sure that the families are coming back for those repeat rebleeds tests and ensuring that the children are being tested on a regular basis, and performing interim controls and referring families for the primary prevention program that's offered through our Milwaukee Health Department. Here, our WIC office as well, a lot of our children, the state has implemented lead testing for children that receive services through WIC, and our WIC site here currently tests about 1,500 kids a year through those services as well. And with that, we have been able to lower down our prevalence rate to what it currently is at a 1.8 level.
Great. Was that your last slide then, Delilah?
Yes.
Terrific. Thanks so much for joining us. I think what was really interesting to me about your program when I first heard about it was that a lot of